Proper storage is crucial for preventing food contamination. Select the appropriate way to store chemicals in a food service operation. A. Above food preparation areas. B. In the same storage area as food items. C. Away from food and food contact surfaces. D. Next to utensils and equipment. Answer: C. Chemicals should be stored away from food and food contact surfaces to prevent accidental contamination. Cooling food properly is essential to prevent the growth of pathogens. Select the correct method to cool a large pot of soup. A. Leave it at room temperature overnight. B. Use an ice water bath and stir frequently. C. Cover the pot and place it in the cooler immediately. D. Place the pot in a freezer. Answer: B. Using an ice water bath and stirring frequently allows the soup to cool quickly and evenly, avoiding time temperature abuse. Contaminated water can be a source of foodborne illness. Identify the scenario where backflow prevention is necessary. A. Installing a new handwashing station. B. Storing cleaning supplies near the food prep area. C. Connecting a hose to a sink faucet without an air gap. D. Using a thermometer to check food temperature. Answer: C. Backflow can occur if there is no air gap when a hose is connected to a water source, potentially allowing contaminated water to flow back into the clean water supply. Employees handling food should wear gloves in specific situations. Select the activity that requires wearing single-use gloves. A. Washing dishes. B. Taking out the trash. C. Handling ready-to-eat food. D. Storing packaged goods. Answer: C. Food handlers must wear single-use gloves when handling ready-to-eat food to prevent contamination. To prevent cross-contact, it's important to handle food allergens with care. Choose the correct action to prevent an allergic reaction. A. Using the same fryer for different foods. B. Cooking food in a clean, sanitized pan. C. Storing food allergens near other ingredients. D. Using shared utensils for all food items. Answer: B. To avoid cross-contact with allergens, food should be cooked in clean and sanitized pans. Maintaining proper food storage is essential for food safety. Select the correct internal storage temperature for TCS foods. A. 32 degrees Fahrenheit. B. 41 degrees Fahrenheit or lower. C. 50 degrees Fahrenheit. D. 45 degrees Fahrenheit or lower. Answer: B. TCS foods must be stored at 41 degrees Fahrenheit or lower to prevent pathogen growth and ensure food safety. The risk of foodborne illness increases when food is held in the danger zone. Choose the temperature range known as the danger zone. A. 32 degrees Fahrenheit to 70 degrees Fahrenheit. B. 41 degrees Fahrenheit to 135 degrees Fahrenheit. C. 70 degrees Fahrenheit to 140 degrees Fahrenheit. D. 100 degrees Fahrenheit to 165 degrees Fahrenheit. Answer: B. The temperature danger zone is 41 degrees Fahrenheit to 135 degrees Fahrenheit, where bacteria can grow rapidly. Cleaning and sanitizing equipment is crucial for food safety. Identify the correct step to take after using a cutting board for raw meat. A. Wipe the board with a damp cloth. B. Store the board for later use. C. Wash, rinse, and sanitize the board. D. Rinse the board with hot water. Answer: C. After using a cutting board for raw meat, it must be washed, rinsed, and sanitized to prevent cross-contamination. Certain foods are more likely to cause foodborne illness than others. Select the food that requires careful handling due to its high risk. A. Whole apples. B. Baked bread. C. Cooked rice. D. Canned soup. Answer: C. Cooked rice is a TCS food and must be handled carefully to prevent time temperature abuse and the growth of harmful bacteria. Food defense systems help protect food from intentional contamination. Choose the best practice to enhance food security in a restaurant. A. Storing food on the floor. B. Monitoring all deliveries closely. C. Allowing open access to storage areas. D. Using unapproved suppliers for ingredients. Answer: B. Monitoring deliveries closely ensures that all food entering the establishment is from approved, reputable sources, reducing the risk of intentional contamination. Proper personal hygiene prevents the spread of foodborne illnesses. Select the correct action for a food handler with a cut on their hand. A. Wash the hand thoroughly and continue working. B. Cover the wound with a bandage and a single-use glove. C. Ignore the wound if it is small. D. Work without gloves, but be careful. Answer: B. Food handlers with cuts or wounds must cover them with a bandage and wear a single-use glove to prevent contamination. Safe cooling practices are essential in food preparation. Choose the method that can be used to cool food safely. A. Leave the food at room temperature for several hours. B. Place the food directly into the cooler while hot. C. Use a blast chiller to cool the food quickly. D. Submerge the food in hot water to speed up cooling. Answer: C. A blast chiller rapidly cools food, minimizing the time it spends in the temperature danger zone. Ready-to-eat foods must be handled with care to avoid contamination. Identify the tool that can be used to handle these foods safely. A. Bare hands. B. Tongs or gloves. C. A spatula used for raw meat. D. A cleaning cloth. Answer: B. Ready-to-eat foods should be handled with tongs or gloves to prevent contamination from bare hands. Time and temperature abuse is a major factor in foodborne illness. Select the correct procedure for reheating food that will be hot held. A. Reheat to any temperature before hot holding. B. Reheat to 130 degrees Fahrenheit for 5 seconds. C. Reheat to 145 degrees Fahrenheit and hold for 10 seconds. D. Reheat to 165 degrees Fahrenheit for 15 seconds. Answer: D. Food that will be hot held must be reheated to an internal temperature of 165 degrees Fahrenheit for 15 seconds to kill harmful bacteria. The USDA and FDA regulate different types of food products. Select the food item that is regulated by the USDA. A. Eggs. B. Bottled water. C. Packaged snacks. D. Fresh vegetables. Answer: A. The USDA regulates meat, poultry, and eggs, while the FDA oversees most other food products. Approved suppliers play a key role in food safety. Choose the type of supplier that should be used for food deliveries. A. Unapproved, to save costs. B. Approved, reputable suppliers. C. Any supplier offering a discount. D. Local suppliers without inspection records. Answer: B. Using approved, reputable suppliers ensures that food meets safety standards and is less likely to be contaminated. Effective pest management is essential for maintaining food safety. Select the measure that can help prevent pests from entering a food facility. A. Leaving doors and windows open. B. Storing food on the floor. C. Sealing gaps around doors and windows. D. Keeping garbage bins uncovered. Answer: C. Sealing gaps around doors and windows prevents pests from entering the facility and contaminating food. Training employees on food safety is critical for preventing contamination. Identify the topic that should be included in employee training. A. Proper temperature control. B. Marketing strategies. C. Equipment maintenance. D. Customer service techniques. Answer: A. Training employees on proper temperature control helps prevent time temperature abuse and reduces the risk of foodborne illness. The HACCP system is designed to prevent hazards in food preparation. Select the Critical Control Point (CCP) in a HACCP plan. A. Receiving food. B. Reheating food to 165 degrees Fahrenheit. C. Storing dry ingredients. D. Taking customer orders. Answer: B. Reheating food to the correct temperature is a critical control point in a HACCP plan to ensure food safety. In the event of a foodborne illness outbreak, certain steps must be taken. Select the correct action to take if food is suspected to be contaminated. A. Continue serving the food. B. Dispose of the food immediately. C. Set aside the food and label it "Do Not Use." D. Store the food in a refrigerator for later testing. Answer: C. If food is suspected to be contaminated, it should be set aside and labeled "Do Not Use" to prevent further risk until an investigation is conducted. Which action should be performed immediately after delivering a shock during a resuscitation effort? A. Check pulse. B. Resume chest compressions. C. Provide ventilation. D. Administer epinephrine. Answer: B. Chest compressions should be resumed immediately after delivering a shock to ensure continuous blood flow to vital organs. In ACLS protocols, what is the preferred route for drug administration during resuscitation when fore access is not available? A. Endotracheal. B. Intraosseous. C. Subcutaneous. D. Intramuscular. Answer: B. Explanation: Intraosseous (IO) access is the preferred route if intravenous fore access is not available because of its quick placement and reliable drug delivery. Normal rate of compressions per minute recommended during high-quality CPR? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. High-quality CPR requires a compression rate of 100 to 120 compressions per minute to ensure optimal circulation. What is the use of hyperventilation during CPR, and what should be avoided? A. Excessive chest compressions. B. Giving too many breaths per minute. C. Insufficient oxygen administration. D. Use of an advanced airway. Answer: B. Hyperventilation occurs when rescuers give too many breaths per minute or too much volume per breath, which can reduce cardiac output by increasing intrathoracic pressure. When using an automated iolator (AED), which of the following is the correct placement of the pads? A. One pad on the lower left side of the chest and one on the lower right. B. One pad on the upper right chest and the other just below the left armpit. C. Both pads on the back. D. One pad over the pacemaker device. Answer: B. For proper AED use, place one pad on the upper right side of the chest and the other below the left armpit. Which medication is typically used for automatic bradycardia? A. Epinephrine. B. Amiodarone. C. Atropine. D. Lidocaine. Answer: C. Atropine is the first-line treatment for symptomatic bradycardia in ACLS protocols. During ACLS, which of the following actions should patient presents with pulseless electrical activity, PA? A. Deliver a shock. B. Perform synchronized cardioversion. C. Administer vasopressors and search for reversible causes. D. Give adenosine. Answer: C. Pulseless electrical activity, PA, is a non-shockable rhythm, and management includes administering vasopressors and identifying reversible causes such as hypoxia or hypovolemia. When treating an individual with ventricular fibrillation, VF, RST treatment priority? A. Defibrillation. B. Epinephrine administration. C. Checking blood pressure. D. Performing synchronized cardioversion. Answer: A. The first treatment priority for ventricular fibrillation is defibrillation to restore an effective heart rhythm. What is the minimum internal temperature hot food should be held at? A. 120 degrees Fahrenheit. B. 130 degrees Fahrenheit. C. 135 degrees Fahrenheit. D. 145 degrees Fahrenheit. Answer: C. Hot food must be held at 135 degrees Fahrenheit or higher to prevent the growth of harmful bacteria. What is an example of time temperature abuse? A. Holding soup at 120 degrees Fahrenheit for several hours. B. Reheating food to 165 degrees Fahrenheit. C. Cooling food from 135 degrees Fahrenheit to 41 degrees Fahrenheit within 6 hours. D. Using a thermometer to check the temperature of hot food. Answer: A. Time temperature abuse occurs when food is held at temperatures that allow pathogen growth, such as below 135 degrees Fahrenheit.